Hey, aloha gang, Dr.Russ Rosen here, and you can see I'm looking down here to see if it's actually going to go live. Okay, so it says it's going live. We're going to go ahead and check and see if it does, because more than half the time it doesn't. Um, okay, let's see if it's going to go live. If you are out there and you are seeing it live, if you could go ahead and, yep, there it is. Okay, if you could go ahead and just let me know who you are, where you're at, and if you have questions along the way, let me know. I will answer those. Um, for those of you who don't know me, I'm Dr. Russ Rosen. I help natural healthcare providers like you thrive in a care versus care, true optimal health model versus masking symptoms while people rot to death. Today, we're going to be talking about the report of findings, a critical piece of the report of findings if you want to do true optimal health model. We're here 3 Tuesdays at 1:30 California time. This community is free. If you find value in today's program, please let others know about it. If you'd like to dive deeper, we'll be in the club in Zoom where we have a discussion for an hour. So it's muted, and I'm not just lecturing at you. We're having a discussion, and you can really dive deep into it and make it yours. Okay. So today we're diving into the report of findings, and here's what I know to be true. Most people that see you, if they actually want to get healthy and stay healthy versus just feeling better, they're going to need to see you more often, and it's going to cost more money than they thought when they came to see you. Now, obviously, if you did a healthcare class and you already explained to them around how much care they might need and around how much money it might cost, that might be different. But if you didn't do that, for most of us, you didn't, then they're coming in and that's not their expectations. So if we want them to stick around long enough, then we need to be able to have this kind of conversation with them. And if they do stick around long enough, then the odds are they can get better results than if they don't stick around long enough. So if they stick around long enough, we can not only help them feel better with what they had hoped to come in, what they came in for, their chief complaint, whatever their symptoms were, but we could actually do so much more for them. We could help prevent problems in the future. Right? Imagine if you're a chiropractor, you're not getting proper nerve supply to the gallbladder and the stomach. You're going to end up with gallbladder and stomach problems eventually down the road. But if you were able to get proper nerve supply, you could prevent that from ever happening. You could literally reverse the effects of the aging process. If you had a patient who did everything you said to do, eat better, exercise, deal with stress, get adjusted, take their nutrients, get acupuncture, whatever it is, could they be healthier in 5 years than they are right now? Yes, a big piece of the puzzle we have to help them understand that they could get if they were to stick around for care. And then, of course, they could have a better life. So I let my patients know, and the doctors that I coach, look, if all I did was help you feel better, but I didn't help you have a better life, I would have failed you. So again, it's really important for you to get clear about what you're trying to accomplish. The doctors that really love working with me don't want to just help people feel better, but they want to help them resolve their issues. Don't just want to feel better, but they want to function better. They don't just want to feel better, but they want to reach optimal health. Okay. So here's what I know many of our concerns are is people come in, they want to feel better as fast as possible for as cheap as possible. So then we stop telling them the truth about what we could actually do for them. We stop telling the truth about what they'd actually need to do. And then we get burnt out because we have this incredible gift to give, but nobody gets it. Nobody wants it. Again, the truth is most people need more care than they thought when they came in. And many of us, we become gun shy to tell them the truth about what they need because we've tried to tell them the truth about what they need and they leave running like their hair is on fire, or They can't afford it, right? They can't afford it. And there's also the headspace issues of what will they think of me? They're going to think I'm over recommending. They're going to think that I'm all about the money. And the reality is the procedure, most of us have no idea how to really give full recommendations to somebody because we never found out what they wanted in relationship to what we could truly do for them. And we're just, they come in, they think they have a hangnail, and you're telling them they need a year of care for $14,000, and they look at you like you're crazy. So it's really important, the consult, the exam, the report of findings. Today we're going to dive into this piece right here. And if you do want this poster right here, just put club below, and I'll give you a month into the club. You can download this, and you can download this from the exam of last week, and all kinds of stuff. Okay, so we break the report of findings up into 3 parts. The first part is reviewing what happened during the consult and the exam. We're not going through that today, but it's a critical piece of the puzzle. The second piece, which we're doing today, is we're going to dive into this critical piece of the puzzle, which is to find out what they really want in relationship to what we can do for them. And most of us are not doing this. And it's a critical piece of the puzzle. And then the third piece is, how do I give a care plan? How do I make my recommendations? How do I come up with recommendations? How do I make the recommendations? And obviously there's a ton there. If you're doing it right, I want to see at least 80% of your patients are signing up for whatever care plan you think is best for them. So if you think that a $3,000 plan is best for them, if you think a $10,000, a $15,000, whatever the truth is that you think they really need, 80% should be signing up for that. If you did consult, exam, and report of findings appropriately, that is what we'll find. And we watch statistics on all of this, and the docs should really get this. That's what we're finding, a minimum of 80%. So it's not hit and miss, right? Don't get gun shy. We're just you need to know how to do this stuff. Okay. From the neuroscience of communications perspective, which we talked about 3 times ago, we need to get our information past the reptilian brain, which is filtering information, into the neocortex for thinking, reasoning, and problem solving. In the limbic system is a new belief system, because that's where all of their buying decisions come from. 100% of the buying decisions come from the limbic system, not from the neocortex. We all think if we educate them and we lecture them and we make it reasonable and logical, they're going to get it, but it's not true. If you understand the neuroscience of communications, you got to learn to speak from your neocortex to their reptilian brain, so they'll send it up to make it logical into the limbic system as a new belief system. So I've got to get them, before I have any business giving a report of findings, before I have any business finding out what level of health they want to get to and showing them a care plan, I've got to get them to say out loud, and we talked about this in the exam, the whole story. So I'm going to say it as if you're a chiropractor. You could be doing functional medicine, you could be an acupuncturist, whatever, but as a chiropractor, they need to be able to say out loud, I understand where my subluxations are. I know what they could be causing. My headaches that I came in for, but also sinus problems, anxiety, mid-back pain, indigestion, coated tongue, stinky armpits, explosive diarrhea, PMS, impotence, pain down the leg, whatever their story is. So they need to be able to say out loud, I know where they are. I know what it could be causing. I know what brought it on in the first place. I know what happens if I don't get it taken care of. I know what happens if I do get it taken care of, feel better, prevent problems, reverse the effects of the aging process, or be healthier in 5 years than I am right now, and I could have a better life. And they need to be able to say, I understand that I have a health problem, not a back problem. Again, if you want this, put club below. You can go in and download that. So if they haven't said that out loud and you've just lectured them, I don't know if they know that. And if they don't know that, you have no business giving them recommendations. Does that make sense to you? If they don't understand that, you have no business giving them any recommendations. Okay. So we're going to do these 4 classic things, in the review. We're going to go over what's going on with them. We're going to go over, can we help? If we can, how long will it take? And then what will it cost? So first part, how long will it take? We're going to do right now. And then what would it cost? It would be the care plan, which we're not going over today. Okay, so what we need to do is, if we did our job in the consult, we made it all about them. We found out what was going on with them, how it was affecting them, at work, play, and home. They recognize that they really want to get better. We've talked about, so if I understand it, you don't just want to feel better, but you want to resolve this, right? We're planting seeds the whole way. And they're saying, yes, yeah, definitely. So now I get to the place where I'm going to go through this part with them. So I've got to be able to get clear. So on this path to health, it is -10 is near death. And thank God most of our patients are not there. 0 is I'm comfortable, I feel good. I'm not functioning at my optimum. If I redid all the tests, range of motion, posture, scans, brain scans, spit, pee, poop, blood, like whatever tests you do, those wouldn't be clear, but they feel good. And then there is as healthy as they can be, functioning at their optimum. And we know it because the tests are clear. So it's really quick. You just, -10 means death. Thank God that's not you. 0 is comfort. You feel good, but you're not functioning at your optimum. And +10 is you're as healthy as you can be. And we would know because your tests are clear. And the question is, how did we go down here? How did we get down here? Well, you were sold to the circus and raised by wolves. So you've had a lot of emotional stress. You were shot out of a cannon for a living, right? You've had a lot of physical stress. You did a lot of crack cocaine and meth with the carnies, right? You've had a lot of biochemical stress. So this is what caused you to come down here. We got to enter the conversation in their mind, because I don't remember getting bitten by the subluxation dog or whatever it is that you're doing with them, right? Functional medicine, whatever. So this is how we got down here. Where do you think you're at? So if you have any symptoms at all, you're somewhere below the 0 line. Now, in my practice, I had about a third of my practice coming in with no symptoms at all. How come? Well, because I was doing my healthcare talk, and the only way to come to see me as a new patient was if you came to the healthcare talk first, and people would bring their spouses and their friends who didn't have any chief complaints. But they understood the concept, and they wanted to prevent problems. And then once you get into it, you recognize most of them do have complaints. They're just not really aware of it at the moment. So where do they think they're at, and where do they want to get to? So one of the things, if you're coaching with me, you'll hear me say over and over and over again, is we're going to find out what they want in relationship to what you can truly do for them and show them how to have it. Now, lots of management companies will say, find out what they want. They want to get cracked. They want their neck cracked. So give them that. Just crack their neck. Don't show them a care plan. Just crack their neck, and they'll become crack addicts, and they'll come over time, right? But that's ridiculous in my world. I want to find out what they want in relationship to what I can truly do for them. So if I can help them get healthy and stay healthy, I'm going to show them that. Now, if they just say, I just want to feel better, and they say, and I understand that you could help me get healthy and stay healthy, I just don't want to do that right now, that's okay. I have 2 choices. One, I can say, I'm going to refer you to somebody else to do that, because that's not what I do. It's not my zone of genius. Or, far out, lay down, let me work with you, and then I have some time to help them better understand this. Maybe they just need to go through the washing machine a few times and come back and recognize, I really want to get this taken care of and resolve it. I don't care. So I'm going to find out what they want in relationship to what I can do for them. I'm going to show them how to have it. I'm going to ask them, how long do you think it would take? If we have mismatched expectations, we need to fix that. And in our program, we show you exactly how to fix it. So, if they think they're a +6 and you think they're a -6, you have to fix that. If they just want to get to a 0 and not a +10, I'm going to be curious about why they wouldn't want to move more towards optimal health and resolve it. If they've have this for 25 years, or 400 pounds overweight, and they think it's going to take 3 days to get better. We've got a contradiction, right? We have mismatched expectations, and I have no business going into the care plan until we've cleaned this up. And again, we show you how to do that. And then here is how motivated are they to get to that level of health. So if they put that they're a 4 on a scale of 1 to 10, I'm not going to show them a big care plan. They're not motivated. They're not going to do it. I need to poke a hole in that belief system. I need to find out why they're not motivated, right? So you've got this terrible low back pain, right? You're impotent. Your wife is talking about leaving you. But on a scale of 1 to 10, you're a 4. What am I missing? Okay, so every step of the way, you need to know how to handle these pieces. But if you just start playing with this, you'll be amazed at what happens with your practice. Find out what they want in relationship to what you can do for them and show them how to have it. We have poster sizes and all kinds of stuff. Okay, so we're then going to find out what they think they need to do. So what do you think you need to do to get to that level of health? Well, clearly you need to become subluxation free. Mark that down, right? So they're marking it down. I think I'm a -4. I'd like to get to a +10. I think it would take 2 years to get there. I'm a 10 on a scale of 1 to 10. I need to become subluxation free. I need to have better strategies to deal with stress, emotional stress. I have to have healthier thoughts, begin or improve an exercise program, specific nutrients, better diet, change my eating habits, other things they know they need to do. People know what they need to do, a lot of them, right? So like you've got to get them to start to take responsibility and make appropriate changes. If you think you're going to help somebody get healthy and they're not going to stop eating McDonald's 4 days a week, you're kidding yourself and you're lying to them. Okay. And then I want to find out what they hope for. So this is where I need to stretch their consciousness. Like obviously you want your symptoms to go away. Obviously, you want to feel better, but would you like more energy, better sleep, healthier weight, more happiness, less anxiety? Would you like to be able to leap tall buildings in a single bound? What would you like? How would we know if you were getting healthier? I want you to think about this. Do you remember in school when they were talking to you about how to talk to people who are past their symptoms? So I ask people all the time, around how many visits till people feel better on average in your practice? It's always somewhere between like 6 and 10. Okay, so let's say that it takes 100 visits for somebody to get as healthy as you can possibly help them get. So the first 10 visits, they're running away from the barking dog of their symptom. The next 90 visits are moving towards something they want. How do you talk to people when their symptoms are gone? You remember in class at school when they talked to you about that? No, because they never talked to you about that. So that's what our program is all about. Like you want to practice in an optimal health model, you got to start to think these things through, right? Okay, so on this form it says -10 means, and here's how we know, 0 means, and here's how we know, 10 means, and here's how we know. Here's how we got there. Where do you think you're at? Fix it if you need to. Where do you want to get to? How long do you think it would take? How motivated are you to get there? What would we need to do to get there? What would you hope for if we got there? So I'm hoping you can see how valuable that tool could be. It's a really important piece of the puzzle. So again, this Thursday at 11 o'clock California time, Pacific time, we'll be diving into in a Zoom class for an hour, discussing that in detail, and then you can download that and start using it in your practice. You want to help people get healthy and stay healthy, we have to start to change the conversation. Okay, so if you are there, please let me know you're there, where you're from. If you have any questions, now is the time to ask. There's usually a little delay here. We got Caitlin Woods in Ireland. Oh, that's the Caitlin Woods. Okay, cool. So I just sent you an email checking to see if you were in Whittier, California, but you're not. You're in Ireland, and I know who you are. So far out. So glad that you're here, and I hope you found value in this. If anybody else is here and you've got questions, let me know. I know most people watch this on the replay, so the replay will be up in just a few minutes. If you have any questions, go ahead and post below. Oh, and Caitlin, you can join the club. I mean, you're in the club, so you can join that call or watch when we go into great detail about that. So I hope that you found value in that. If you did, please let other people know. If you want to jump into the club, you want to download the poster, the handout, etc., just go ahead and put club below, and I'll let you in there. Again, as always, much love and aloha. Bye, gang.